said, we're going to start this session today on the cardiorespiratory system, breaking that down into circulatory and respiratory system. As I mentioned earlier, feel free to use the More button, use the accessibility sections of it, of language and speech, where you can turn on live captions if you want to help you with this session. So what we're going to look at when it comes to the circulatory system, first of all, is we're going to explain the structure and function of the circulatory system. We'll identify the location of the heart, describe the function of the heart, how blood moves through the heart, the systemic and pulmonary circulation, the structure and function of blood vessels, and also defining blood pressure classifications. So as we go through it, make sure to ask questions as you want to. Use the raise hand function if you want to as well. I will be asking some questions, so feel free to jump in, answer the questions as we go along. If you don't know the answers, no problem at all. Hopefully by the end of the session, you will know the answers. Okay, so first of all, we're looking at the heart itself. Okay, so the heart, also known as the myocardium, is located in the chest slightly to the left. Can anybody tell me why we describe it as slightly to the left? Okay, so the left, yeah.
Is it just because it's off from like the center line of your body, like it's not completely over to the left?
Well, the center of the heart is located on the center line of the body. The reason that we say it's slightly to the left is because the left side of the heart is bigger than the right side. So the left side of the heart pumps blood all around the body. So that left side of the heart is bigger than the right side of the heart because of that reason. And that is why we describe it as sitting slightly to the left. But if we were to put a pin through the center of the body and through the center of the heart, they would line up. Okay. So the heart itself is a pump to maintain circulation. It's split into two halves. We've got the right side and the left side. So the right side pumps deoxygenated blood, so blood without oxygen, and the left side pumps oxygenated blood, so blood with oxygen. It's got four chambers, two upper collecting chambers called the atria, and two lower pumping chambers called the ventricles. And valves within the heart ensure that the flow is one way. So what that means is if we look at the atria and the ventricles, the top two sections, between the atria and the ventricles, we've got a valve. So when that valve opens up, it allows blood to flow from the atria into the ventricle. The valve will then close, preventing backflow of blood back up into the atria. Coronary arteries will supply the heart muscle with oxygenated blood. So because the heart is a muscle itself, it needs its own blood supply, which will carry energy, oxygen, water, nutrients, etc. to that working muscle. So the coronary arteries will branch off and supply the heart muscle with oxygenated blood. Here we've got a diagram of the heart muscle. So this is quite a medical diagram because it shows the shape of the heart and it shows the exact location of our tubes that supply deoxygenated blood and oxygenated blood to and from the heart. So I'm just going to describe this. What I've also got to go alongside this section is a video on the circulatory system, and it shows how blood flows through the heart and how it flows around the body. So I'll refer to that in a second. So what we're going to look at here is the right side of the heart. Now, as we look at the heart itself, we swap over left and right. So the blue tube, the superior and inferior vena cava, will supply deoxygenated blood into the right atrium. Okay, can you see my laser pointer?
Yeah, you can see it.
Yeah, cool. Okay, so this blue tube here with the blue arrow, so we've got the top one here, which is the superior vena cava, and the bottom one down here, which is the inferior vena cava. Deoxygenated blood carrying carbon dioxide will flow into the right atrium. So this is our right atrium here, which is the top chamber on the right side of the heart. So it's your right side. So as you look at somebody, you're looking at their right side. The atrioventricular valve, which sits in between the right atrium and the right ventricle will open up, allowing blood to flow into the right ventricle. So this right ventricle here will fill up with deoxygenated blood. The muscle, the heart muscle, will contract and allow blood to flow out through this valve here, which is called a semilunar valve. So that semilunar valve opens up as the right ventricle contracts, and blood will then flow out through the pulmonary artery. So the pulmonary artery will then take deoxygenated blood to the left lung and the right lung on either side of the heart. Within the lungs, we have what's called diffusion or gaseous exchange. So gaseous exchange will take place where carbon dioxide will leave the body and oxygen comes into the body. So from our left and right lungs, the pulmonary veins, which are this tube here and this side here. So the pulmonary vein will bring that oxygenated blood into the left atrium. So the left atrium here will fill up. When that's full, the atrioventricular valve will open, filling up the left ventricle. Once the left ventricle is full, the heart muscle will contract, opening up the semilunar valve, and then blood will flow out through the aorta. The aorta then will branch off into arterioles, arterioles, and then supply oxygenated blood to all of the systems of the body. So the muscular system, the digestive system, all around the body, giving it its oxygen supply, nutrients, energy, water, etc. When that oxygen is used up, so say, for example, in skeletal muscle, we use up the oxygen, gaseous exchange takes place again. So within the systems of the body, we use up our oxygen and our waste product, carbon dioxide, is produced. That carbon dioxide then travels back towards the heart from the capillaries into venules, into veins, and then back to our superior and inferior vena cava to start the process all over again. Okay, so as I said, I do have a video to go alongside this. Let's see if this works. I'm not going to play it for you now. Some of you may have seen this before. So this is me going through the flow of blood, basically what I've just described, but I'm going to draw it in diagram format as well. So I'll send you the link to this as well, so you can watch this. And what I would advise is that you draw this picture that's behind me in the video first, and then draw along as I'm going through it. Is that okay?
Yep, no worries.
Yep, cool. Okay. What I'll do is tomorrow morning session, I'll do a quick recap. So if you could watch that video this evening at some point, it's not very long, I think it's about 8 minutes long. If you could watch that this evening, and then I can kind of pick up any questions or comments or anything like that tomorrow morning before the start of that session tomorrow morning. Okay, so it's quite complicated, and it is, like, I'm not going to say it sounds quite complicated because it is quite complicated, but knowing the flow of the way that blood flows through the heart is quite important to understand how the heart muscle itself works and how we supply our skeletal muscles and systems of the body with oxygenated blood, nutrients, water, etc. Okay, so the next section then we're going to look at arteries. So as I described, we said that arteries will supply the systems and muscles of the body with oxygenated blood. So the rule is that arteries carry oxygenated blood away from the heart supplying vital organs and tissues. So if we remember, A for arteries means A, away from the heart. They have got a thick muscular wall to allow blood to be shunted around the body. So if we think about the left side of the heart being that largest part, as it contracts, it shunts blood around the body. So blood leaves the heart with high pressure. So they need a thick muscular wall to be able to cope with that high pressure, but also the muscles within the arteries help the flow of blood around the body. So as I said, they deal with blood under high pressure. There's one exception to the rule. Our pulmonary artery is the only artery that transports deoxygenated blood from the heart to the lungs. It's still classed as an artery because it's taking blood away from the heart. To flip that, veins. So veins carry deoxygenated blood back towards the heart. So if we remember way in, so it's bringing blood to the heart, into the heart. They have got a thin muscular wall, so they're not dealing with blood under as high a pressure as arteries are. Valves are contained within the veins to assist blood flow back to the heart and prevent backflow. So if we think about after a heavy exercise session where we get what's called blood pooling. So this is where blood will stay in the lower parts of the body. You might feel dizzy or faint as a result of this. So valves will assist blood flow back towards the heart. So if we think about, we've got a lot of blood in the legs, as blood flows back up through the veins, the valves will open up and then close, preventing blood from falling back down into the lower parts of the body. Our one exception again here is our pulmonary vein. So the pulmonary vein is the only vein that transports oxygenated blood, and it takes it from the lungs back to the heart. But it's still classed as a vein because it's bringing it towards the heart. Capillaries. So arteries become smaller to form arterioles, which link to capillaries. Capillaries are one cell thick and allow gaseous exchange to take place. So within the systems and organs and muscles of the body, we exchange our gas. So oxygen will jump from the capillary into the system or the muscle of the body, and then our waste product, carbon dioxide, will jump from the system or organ of the body into the capillaries. Then from those capillaries, venules will take blood into the veins and then into the vena cava to start the process all over again of the flow of blood around the body. And the circulatory system looks a little bit like this. So what we've got is the heart in the middle. Our blue tubes represent deoxygenated blood and the red represents oxygenated blood. So if we start on the right side, get my laser again, start on the right side here, we've got our superior vena cava and inferior vena cava taking deoxygenated blood into the right atrium. The right ventricle will contract, taking blood out of the pulmonary artery to the left and right lungs. Gaseous exchange takes place here. So we get rid of carbon dioxide. Oxygen then comes into the capillaries, back towards the heart via the pulmonary vein, fills up the left atrium, fills up the left ventricle. The heart will contract, taking blood out of the aorta, then around the body. All systems and functions and organs and muscles of the body. Our oxygen is used up. Carbon dioxide is our waste product, flows back towards the heart via the venules, superior and inferior vena cava to start the process again. Any questions before I move on?
No, all good here.
No? Cool. Okay. So we're going to split into two sections now as well. So we've got pulmonary and systemic circulation. So first of all, pulmonary circulation is the flow of blood from the right side of the heart to the lungs and then back to the left side of the heart. So if I show you that, we've got pulmonary circulation from the right side of the heart out to the lungs and then back to the left side of the heart. Oh, I thought I had my laser pen open then, sorry. So we've got from the right side of the heart out to the lungs and then back to the left side of the heart. Anywhere you see pulmonary, it means respiratory system, lungs. So if we think about pulmonary conditions, it's normally a medical condition to do with the lungs. Okay, so pulmonary means lungs. So pulmonary circulation is from the right side of the heart to the lungs and then back to the left side of the heart. Systemic circulation is kind of, as it says on the tin, the flow of blood from the left side of the heart to all parts of the body and then back to the right side of the heart under higher pressure. So if we think about it, it's taken from the left side of the heart to all systems of the body and then back to the right side of the heart. If we take a quick look at that again, we've got from the left side of the heart all the way around the systems of the body and then back to the right side of the heart. So systemic circulation. Okay. Blood pressure then. So blood pressure is the pressure within the arteries. So it's the pressure that is put on the artery walls as blood is pumped around the body, as the contraction of the heart releases blood out of the heart, and that pressure on the artery walls. It's measured by systolic pressure when the heart contracts and diastolic pressure when the heart relaxes. So if you think about if you've ever had a blood pressure reading done, hopefully you normally get a reading of 120/80. So 120 is our systolic reading when the heart contracts, and 80 would be our diastolic reading when the heart relaxes. So regular exercise can lead to the reduction or normalizing of high blood pressure. So if we do have a client who has got high blood pressure, by doing regular exercise and also looking at nutrition and diet, can lead to the normalizing or reducing that high blood pressure reading. And what we've got next are our blood pressure guidelines. Now, these may vary. If you look at different journals or different sources of information, they may vary. But for us, these are the classifications that we go by. So what we've got here is our category down the left-hand column, our systolic reading in the middle, and our diastolic reading on the right. So low blood pressure would be classified as anything under 100/60. So 100/60 would be classified as low blood pressure. Optimal blood pressure, what we're looking for is around 120/80. Okay, so that's what we're looking for. That's our optimal reading. What we're seeing as normal is around 130/85 as a normal blood pressure reading. The high side of normal is 130/139/85 to 89. Stage 1 hypertension. So hypertension means high blood pressure. Hyper meaning high. So stage 1 hypertension would be 140/159/90 to 99. Stage 2 hypertension, 160/179/100 to 109. And then stage 3 hypertension would be anything above 180/110. Right. So at what point would we need to refer our client for medical attention if we were to do a blood pressure reading with them? Can anybody tell me?
Stage 1?
Stage 1. Stage 1 hypertension. So if we've got a client who is getting kind of regular readings of 140/159/90 to 99 or above, any of these readings here, we would need to refer them back to their GP, back to their doctor, just to get their blood pressure checked. Okay. Now, what we might find is when we do a blood pressure reading, we might get what's called a false reading. So depending on the environment, depending on kind of what the client has been up to that day, will influence their blood pressure reading. So if you think about if you're running late, you've had a stressful day, you've run up the stairs to the gym, had your blood pressure taken, it might give you a higher reading than what it would normally have. So during exercise, blood pressure goes up. So obviously we want to make sure that we do our blood pressure reading before exercise and with our client as as a relaxed state as possible. Okay. So if we're getting a reading of 140/90 with our client, we can ask them simple questions like, okay, what have you been up to today? Have you had a stressful day? Have you been kind of running about? Is that the reason why your blood pressure is just slightly high? If we can justify that, we don't necessarily have to refer them back for medical attention. But if they come back a couple of days later or the following week and we're getting the same types of readings, that's when we maybe have to refer them back. Okay. If we've got a client at stage 3 hypertension, they should already be under medical supervision. And we would not recommend exercise for anybody who is at stage 3 hypertension. Can anybody tell me why? I kind of gave the answer a little bit earlier.
It's just too high. You'd already be increasing the blood pressure that's already high. So essentially, it'd be dangerous.
Yes, exactly that. So as I said, during exercise, blood pressure increases. So if our client is already at 180 over 110 before exercise, during exercise, that's going to go up even higher, which is, as you said, very dangerous for our client. Now, ideally, they should already be under medical supervision. So if they're coming to exercise in the gym, they should have had that recommended by their medical professional, but then also be under supervision of an exercise referral instructor. Okay. If they're not, then it's something that we need to address, and we need to make sure that we've got the correct information from the medical professional before we can allow them to exercise within the gym environment. Okay. Any questions on any of that? Because that is circulatory system.
No, all good.
Cool. So it's quite
No,
short,
good.
but what we... Somebody have a question then?
No, just said all good.
Okay, cool. So as I've said, so we've looked at the structure and function of the circulatory system, location of the heart, function, how blood moves through the heart, systemic and pulmonary circulation, the structure and function of blood vessels, and we've also looked at our blood pressure classifications. So it seems quite a short section, but there is a lot of information involved in that. As I said earlier, I will send you that video out as well as to how blood moves through the heart. Okay, we're going to crack straight on into the respiratory system now. So as part of the respiratory system, we're going to identify the location of the lungs, describe the function and structure of the lungs, identify the main muscles involved in breathing, describe the passage of air through the respiratory tract, describe the process of gaseous exchange, and then look at the effects of age, pregnancy, and disability on the cardiovascular and respiratory systems. Okay, where are the lungs located? Can anybody tell me? Sounds like a simple question.
Left and right side of your body. On
Yeah.
your chest.
On your chest, yeah. Nice and simple. Okay, so a bit more of a technical description would be located in the thorax or the thoracic cavity and protected by the ribs. So you're not wrong in the answer that you gave, but what you might see on the question paper is something a little bit more like this. Okay, what you might also see, and similarly with the location of the heart, it might say posterior to the sternum. So the heart muscle now I'm talking about, sorry. So the heart located posterior to the sternum, sitting slightly to the left. The lungs could also be sitting posterior to the sternum within the thoracic cavity. Okay, so we're kind of getting a little bit more medical description of where they're located. So as we can see in the diagram here, we've got the labeled diagram of the respiratory system. So air will travel in through the nose and the mouth, past the pharynx, which is in our sinuses, and then past the larynx, which is in the throat. So the larynx is that flap which basically will cover off our windpipe when we're eating food. And it will open up, obviously, when we're getting air in. So the larynx will then open up, allow air to flow down through the trachea, which is our windpipe, and then the trachea will branch off into two bronchus. Use my laser pointer. Into two bronchus. So our nose, air travels into the nose and mouth, past the pharynx, the larynx, and then down the trachea, branching off into two bronchus, and then our bronchus will branch off into bronchioles. At the ends of the bronchioles, we've got our alveoli, and this is where gaseous exchange will take place, the alveoli. One of our respiratory muscles is the diaphragm, which is situated just below the lungs at the bottom of the rib cage. So air that we breathe is made up of inhaled air, 79% of it is nitrogen, 21% of it is oxygen, less than 1% of it is carbon dioxide, and less than 0.001% of it is made up of trace gases. Excuse me. When we exhale, so the air that we breathe out, 79% of it is nitrogen. So all of the nitrogen that we breathe in, we will breathe it straight out again. 17% of the air that we exhale is oxygen. So we only retain about 4% of the oxygen that we take in. Carbon dioxide, 4% of the air that we exhale is made up of carbon dioxide. And again, less than 0.001% of our trace gases are exhaled. So it's quite interesting to see that we actually breathe out more oxygen than carbon dioxide. Okay, so 17% of the air that we breathe out is oxygen and only 4% of it is carbon dioxide. Is anybody here first aid qualified or lifeguard qualified?
Yeah, George and I are.
Yeah.
Yep. Okay,
Yeah, me too.
cool. So so if you've got an unconscious casualty, okay, not breathing, you've checked the area, you've called for help, you've checked airway ABC, what is one of the first things that you will do when it comes to CPR? Or even as part of CPR, not just one of the first things, but as part of CPR.
Check if they're breathing.
So yeah, we've done that. They're not breathing.
Breath of life.
Breath, exactly. So we're going to give rescue breaths. So if we think about the rescue breaths that we give, 17% of the rescue breath is oxygen, and only 4% of it is carbon dioxide. So this is why rescue breaths are so important. People kind of think, oh, but I'm only breathing carbon dioxide into them, into this casualty who's not breathing. Whereas actually 17% of the air that you are breathing into them is oxygen. So this is why rescue breaths are so important. Does that make sense?
Yeah.
Cool. So it's just kind of good to know that, you know, rescue breaths, it's not carbon dioxide that you're breathing into them. It's actually you're breathing more oxygen in. And that's why it's so important to get those rescue breaths in and done properly as well. Cool. Okay. So we're going to look at next the process of breathing, how we breathe. And we do that through the respiratory muscles. So the lungs themselves are not muscles. The lungs are two air sacs that sit in the thoracic cavity. Our first respiratory muscle here is the diaphragm. As we can see in the diagram, it sits at the bottom of the rib cage underneath the lungs. So it's a dome-shaped muscle that sits underneath the lungs at the bottom of the rib cage. When it contracts, it flattens, increasing the thoracic cavity. So at the moment, it's in a dome shape. When it contracts, it will flatten and lie across the bottom here. So we're increasing the space that is within the thoracic cavity. We've also got our external and internal intercostals. So the external intercostals will pull the ribs up and out. So again, increasing the space within the thoracic cavity. Because that space has now been increased because of the diaphragm flattening and the external intercostals pulling the ribs up and out, that space now needs to be filled. So air is pulled in through the nose and mouth, down the trachea, and inflates the lungs. To exhale, the internal intercostals will pull the ribs down and in, and the diaphragm will relax back to its dome shape, reducing the space within the thoracic cavity and essentially squashing our lungs, our two airbags, and then pushing air back out of the body, out of the lungs, out through the nose and mouth. Okay. I do have a video to back this up as well, which kind of gives you a nice animation diagram of how this works and how the respiratory muscles create inhalation and exhalation. So if you think about the heart is a muscle and it contracts and relaxes. The lungs are not muscles. Okay, so the lungs are just air sacs. It's the diaphragm and the internal and external intercostals that will create inhalation and exhalation. Does anybody want me to go through that again? If you've got any questions. Yeah.
No, all good.
Yeah. Okay. So then gaseous exchange will take place within the lungs. It's also known as diffusion. So if you see diffusion written down, it means gaseous exchange. So it's the exchange of gases, oxygen and carbon dioxide within the lungs. This occurs within the capillaries that surround the alveoli in the lungs. And it looks a little bit like this. So we've got our bronchiole, which is coming down here, and at the end of the bronchioles, we've got the alveoli. Our red capillaries surrounding the alveoli have just taken in oxygen, and are taking that oxygen back towards the heart via the pulmonary vein. Our blue capillaries here, the heart has contracted and the pulmonary arteries have brought our carbon dioxide to the lungs and to the alveoli. So gaseous exchange takes place. So the carbon dioxide within the capillaries will jump from the capillary into the alveoli, and then it's exhaled back out through. Our oxygen comes in, diffusion takes place where our oxygen will jump from the alveoli into the capillaries, and then our pulmonary vein will take it back to the heart to then be pumped around the body. Does that make sense?
Yeah, it's good.
Cool. So what we've got here is pulmonary diffusion. So pulmonary diffusion, pulmonary meaning lungs, so the exchange of gases within the lungs. We've also got systemic diffusion, which is within the systems of the body. So when we looked earlier at the flow of blood around the body, within the organs of the body, within the muscles of the body, we've got our systemic diffusion. So exchange of gases within the systems of the body. Right. What we've got next is the passage of air. So how air flows around the body. Right, I'm going to read this and then we'll have a chat about it. So first of all, oxygen comes in through the nose and mouth, past the pharynx, past the larynx, down the trachea, a windpipe, which branches into two bronchus, left and right. Into the lungs, down the bronchioles, and down to our alveoli, where pulmonary diffusion takes place. Our oxygen then jumps into the capillaries that surround the alveoli, and the pulmonary vein will take that oxygenated blood back to the heart via and into the left atrium. Our atrioventricular valve will open up, allowing blood to flow from the left atrium into the left ventricle. The heart will contract, pumping blood out through the semilunar valve, out of the aorta, which branches into arteries, arterioles, and then the capillaries within the systems of the body that it's been sent to. So if we think about the muscular system, systemic diffusion will take place where we use our oxygen, and our waste product, carbon dioxide, will then jump into the capillaries and be brought back towards the heart via the venules, the veins, and then into the heart through the superior and inferior vena cava. Filling up the right atrium, our atrioventricular valve will open up, filling up our right ventricle. The right ventricle will contract, taking blood out through the semilunar valve into the pulmonary artery, taking blood back to the lungs, to the capillaries surrounding the alveoli. Pulmonic diffusion will take place where carbon dioxide jumps into the alveoli, then it's brought out through the bronchioles, up the bronchus, up the trachea, past the larynx, past the pharynx, and out through the nose and mouth. So that is the flow of air or passage of air around the body. Any questions?
No, clear as mud.
Okay, right. So what you can do with this is the video that I send you of me drawing the heart and the flow of blood to the heart, you can kind of follow it along with this. So when I'm doing that, obviously I'm not doing the lungs as that part, but when it comes to the heart section, so this middle section here, you can kind of follow it along. So some people will like to watch the video and take all the information in through the video. Some people like to read it this way and kind of learn it that way. So you've got different options as to how you can kind of best get that information in. Okay. Right, our final section then, we're looking at the cardiorespiratory system and special populations. So we've got children first of all. So we're looking at the age 14 to 16 age range actually. So children have got a lower blood volume. Obviously they're smaller, so they've got less blood. They are less efficient at temperature regulation. So if we think about when we exercise with children, we need to think about the environment that we're training in. If we're in a hot environment, it's going to take them longer to cool down and also be able to cope with that hotter temperature. If it's a cooler environment, it's going to take them longer to warm up. So we might have to do a longer warm up section. We might have to do a longer cool down section as a result. Their heart chambers are smaller, so their heart rate is higher and stroke volume is lower. So stroke volume is the amount of blood pumped per beat. So because that heart muscle is smaller, it means that the heart has to beat more times per minute to get the required amount of blood and oxygen, etc., around the body. They are less efficient at processing oxygen as well. So again, when we're doing exercise with younger people, we need to think about giving regular breaks. We need to think about the intensities that we're working at as well. Our next group is pregnancy. So the cardiovascular system is enhanced simply because it's now working for two. Blood volume increases because again, we've got to it's got to work for two individuals. Stroke volume and cardiac output both increase. So stroke volume, the amount of blood pumped per beat. Cardiac output, the amount of blood pumped per minute. So the amount of blood that is pumped around the body goes up, again, because it needs to work for two. Resting heart rate will increase. So beats per minute will go up, again, because it's got to work for two. Venous return will decrease. So what that means is we can get blood pooling so that return of blood from the lower extremities back up to the heart is not as efficient as what it used to be. So again, if we're working with somebody who is pregnant, we need to think about their recovery, allowing regular breaks to help with venous return. We need to watch out for dizziness and potentially fainting as well if our intensity level is too high. For our aging population, so some of the age-related changes can be as follows. Cardiac output can decrease, the amount of blood pumped per minute. VO2 max can decrease, so that's the volume of oxygen uptake, so the amount of oxygen taken into the lungs in one breath. Maximum heart rate will decrease because it's age-related. Blood pressure can increase, and a general reduction in the efficiency of the cardiorespiratory system. So again, we take this on a case-by-case basis. So we need to think about our warm-ups, our cool-downs, potentially doing longer warm-ups, longer cool-downs, looking at maybe doing interval sessions rather than long duration work. So intervals where we would do a bout of exercise, have some recovery, bout of exercise, have some recovery. So that's not high intensity intervals. That's just regular intervals where we would do work, rest, rather than just 10, 15 minutes of work, if that makes sense. Okay. Final one, disabilities. So there are a range of medical conditions and disabilities which can have an impact on the function of the cardio and respiratory systems. These will be specific to each individual. Now, we could do a whole course itself on looking at different disabilities and how the cardiorespiratory system affects them. The best person to ask is the person themselves. How do you do? How does it affect you? How do you do CV work? Cardiovascular training. How does it affect you? What should and shouldn't be done when it comes to cardiovascular exercise for you? Other than the individual themselves, obviously we can look at medical professionals to give us more advice and guidance. So if they're working with a physiotherapist or a consultant, we can contact them and ask for advice and guidance as to how best to program for this individual. And that is our respiratory system. So we've identified the location of the lungs, described the function of the lungs, structure of the lungs, looked at the main muscles involved in breathing, looked at the passage of air through the respiratory tract, process of gaseous exchange, and then looked at the effects of age, pregnancy, and disability on the cardiovascular and respiratory systems. Has anybody got any questions, comments?
No, all good here.
Okay, great. Okay, bear with me. Stop recording.